Okay, so welcome back to our afternoon session. Our first speaker is Dr. Rob Rutledge. He's continuing on and now talking about the mind-body connection, empowering yourself on the cancer journey.
Had a very good question in the break about, I'm kind of more of an anxious person. I could never kind of sit and kind of meditate. It's just be too hard. My response was you can do that kind of meditation through different activities. And the key point is to be able to recognize when you're thinking, bring your attention back to whatever it is. So people do like Qigong or Tai Chi or mindful walking, any kind of activity in which you can recognize when you start to think, and then you bring your attention back to the sensations in your body or whatever, your breath and so on. So that's the power of meditation. It can be done in the day-to-day in regular activities. Part of meditation and mindfulness is recognizing our thinking, and this whole next section is around this idea that our thinking can affect how we feel. So if you think, I'm no good, that will actually cause an emotional response, kind of depression and so on. So that's the most obvious example between the thought influencing the emotion. And the idea is if you can be mindful, then you can actually change your thinking and change how you feel. And oftentimes there's distressing thoughts that you can also work with and kind of reframe. And so the idea is you can change how you see yourself, see life, see the world by working with your thoughts and your kind of core beliefs. And ultimately you feel better and more productive and so on. So just feel like a better person. The technique is based on this idea that you able to separate the situation, the truth of the situation, which overlies everything, with your thoughts about the situation. And if you can't agree that sometimes their thinking doesn't necessarily reflect reality, then you won't be able to get this exercise at all. If you think every thought you think is true, then when you change your mind, you'll figure out that you're wrong. So the idea is your thoughts can be adding extra suffering on an already difficult situation, and that by reframing, by acknowledging what's happening, by looking at the situation in a different way, and by encouraging yourself, you can actually feel better with the same situation, the same circumstance. It's probably easiest to take it through some examples. So maybe a young man's getting adjuvant chemotherapy for testicular cancer, and during that time, maybe the third or fourth cycle, at some point they run into a time when they're physically tired, which just happens during chemotherapy, and they're kind of emotionally raw. It's like we can just kind of feel more irritable, just feel a little bit awful. So that happens, and again, that's not a judgment, it's just that's the emotional state during this. And so it's a difficult circumstance, and if they're really down, they might have this extra thought. And the extra thought is, it's no use, I don't have the strength to get through this. Right? So they're taking a difficult situation, then they're adding on this extra thought there. If they can recognize that they're thinking that, then they'll be able to start to reframe that. And the second part of it is actually look at the thought more closely and kind of question that type of thinking. So I'm going to ask you then, what emotions will follow this thought? What will this thought cause that person to feel? Describe those emotions. If you said to yourself, it's no use, I don't have the strength to get through this, what emotional state would you find yourself in? Defeated, some more words? Sadness, yeah. Depressed, good. Frustrated, despair. So you're tapping into that kind of feeling. What happens to your physical body when you feel those emotions? Your weakens, you're really kind of pushing yourself down that kind of spiraling tube. You're actually manifesting your kind of thought. Is it helpful or harmful? Is this young man actually helping himself when he's thinking like that? Harmful, yeah. So he's actually decreasing his energy. In what way, now, be like a lawyer to the situation. If you're a lawyer trying to argue against that statement and the rationale that goes along with that statement, how would you argue against that person? What would you say That you're not quite right because why? Yeah, you're not thinking clearly, but I want you to actually argue, like, these are the points of, like, I'm going to give you counterpoints to go against why what you say is not quite right. You're wrong because? Right, yeah, people do get through this. How about it's no use? We'll just look at it. It's no use. Is that true? The guy's going through chemotherapy. He's improving a chance of cure. It's no use is actually not true because he's actually increasing his chances. I don't have the strength to get through this. How is that not true? It's possible that he's too weak to go through the next course of chemotherapy, but how is that not true in his circumstance? So the fact is he is actually getting through this. He's taking this a day at a time. This is going forward. So he's actually succeeding. So those thoughts aren't quite right. Now, if you were his best friend and trying to somehow encourage him in some way or form, what would you say to him? This is the reframe. Now you're trying to tap into this idea of being kind and wise, both at the same time. And I'll go up just to remember, acknowledge the difficulty, look at the situation in a different perspective, encourage yourself. Okay, so how would you talk to that friend? Go ahead. Yeah, a lot of people have gone through this. I'm with you. So that's the kind of practical things, and realizing that this is all going to happen internally. This is the voice in your own head there. So how would you talk to your friend? What's the encouragement piece? Or what's the acknowledgement piece? I'm here for you is, again, it's internal. So you're saying to yourself, I'm here for myself, so it's kind of weird. What else? This is hard. So it's the acknowledgement piece. This is hard. Right? Just to say, I'm going through a tough time. This hurts. So instead of kind of pushing away those difficult emotions, you say, geez, this is hard. And it's the quality of the voice. It's not a, smarten up, suck it up, buttercup. It's not like whipping yourself. It's like, geez, ouch. This hurts. This is a tough time. What's the encouragement piece? How do you encourage somebody through a difficult situation? What's the... Yeah, so you're acknowledging emotions first, and then what's the encouragement part? Yeah. Yeah. How do you buy yourself a coffee? One day at a time. Like this, just take this one step at a time. You are getting through this. This is tough. You are getting through this. And then, you can what? Go ahead.
Well, I think it might be useful to acknowledge that this is typically a young man.
Yes. Yeah.
They're probably not becoming rational, right? It's your best buddy.
Right, yeah.
They're going to be saying some things that, that best buddies say to themselves.
Yeah.
Say to each other, right?
So what do best buddies say to each other?
Well, I don't think I can say it.
Well, no, actually, because...
The young guys in here, right?
Yeah.
If someone's giving a pep talk to them and is truly a best friend,
Right, yeah.
they're probably going to tease a little bit about,
Come on, can you...
get out of yourself.
Yeah. Yes. Right.
Keep going.
Yes. Okay.
Because guys, they're not warm and tender to each other.
Right. But but this is great to actually hear this now in your life, because you are going to live almost certainly for another 20, 30 years where you actually want to use the kind of the tender part. But there's this kind of aspect. That voice can actually be the coach that you really respect in high school. And yes, they screamed at times, but you knew that fantastic coach really loved you, really cared for you, right? And so there is that sense of, come on, you can do it. You've done tough things before, you can do it again. So now you're hearing my voice of the encouragement piece, but the acknowledgement, encouragement piece, and so on. Now, we happen to reframe at kind of a deeper level, not to say that it's any better in any way or form. Who says you always have to be strong? Sometimes cry and fall apart is the best thing to do, and you really kind of give up and so on. But that's another kind of way of reframing. Okay, what if there's been a delay in diagnosis, and there's been some obvious gaffes within the medical system, and then on top of that kind of reality, the line in the head comes out, the medical system sucks. So then how do you work with that? Or do you just say, that's the truth? So if you thought that way, does it create extra suffering? What kind of emotions fall away? The medical system sucks. Frustration, anxiety, right? How does that affect the body? Stress reaction, right? This kind of frustration, anger feeling. Is it helpful or harmful? You might just realize, I've learned lots from the medical system, things can happen wrong and, that type of thing. And I have to be smart about advocating for myself. But we're just talking about the kind of gross exaggeration. Is it harmful or helpful? Probably this frustration, anxiety is not helpful. So how is it exaggerated or rational? The medical system sucks. And we're trying to tease out the extra suffering, not the 95% that could be true in that circumstance. Right, exactly. I mean, your doctor could, but but the point is, where's the 5% where the medical system is good, or the 95% where it's good, right? Is it 100% every single aspect of the whole medical system sucks? Is that the truth? No. There are some good people there are some good services, et cetera, et cetera. So you can start to look at it. Because if you're in that frame of mind, you'll bring your attitude into every situation, and it will actually decrease the quality of interaction, decrease the quality of care, right? So this thought is actually having a self-fulfilling prophecy. So what was the kind of rational reframe? If you thought that to yourself, the medical system sucks, what would you think? When it's back to what we've done in the middle section, which is, there are good people. They've got me this far. They're relying on science. You kind of talk to yourself, I can advocate for myself. So there are lots of ways to kind of work with this, including acknowledgement. This is a really frustrating situation. Just kind of the acknowledgement. Okay, one more example. So you break up with your girlfriend, for whatever reason. On top of that difficulty, and I'm not saying that's not difficult and sad and grieving the whole aspect, on top of that reality, you add this extra thought. And the extra thought is, I'll always be single, nobody will ever love me. Right? So that can happen. It's happened to me before. So what emotions fall that way of thinking? Nobody ever loved me. Sadness, grief, soreness, despair, however it is. How does it affect your body? It's kind of depressing, right? It's not helping you feel better. Is it helpful or harmful? Probably harmful if you take that same attitude into the next relationship. How is it exaggerated or rational? Right? This one's a bit more obvious, right? I had to joke with this one myself because I thought there are some blind girls in the world, so maybe I'll be okay type thing. So anyways, nobody will ever love me, right? I'll always be single, right? So, that's just not true. If you just did a survey of every breakup and then, people never, found another girlfriend, that's not how the world works. So obviously it's exaggerated in some way or form. What would you do is kind and rational response? What would you say to yourself? Just broken up, you're feeling really down. Yeah. What do I say to myself? Yeah, exactly. Yeah, exactly. Well said. Anyways, I just say, geez, I'm hurting right now, but there are lots of fish in the sea. That type of feeling, like things can work out despite feeling really lousy right now. So, all right. So that's the idea: is working with the thoughts that are coming forward, and I want to finish on just this idea of changing your brain for the positive. So the idea is whatever emotional state you bring yourself into, or your whatever states there are, that will be leave a residual within it. And that as you practice being in different states, you'll get better and better because the neurons that fire together wire together. And we had this idea of the monks, and David referred to the guys that actually practice compassion, actually get a thicker part of their brain. So it's kind of lighting up in that center, the attention center and the compassion pathways within this MRI scan of the brain. And even the nuns that go through these kind of religious experiences also kind of change the patterning within their brain itself. The idea is that you can grow inner strengths if you practice. If you actually practice, think about a state that you want to be in. In fact, this is the idea. So if you want more confidence in your life, or more peace in your life, or more happiness in your life, or more gratitude in your life, you actually practice being in those states if you go there. And there are lots of different strengths that we go through. So our brain is made up of both positive and negative experiences, the negative and red. The problem is that we're so biased to learn from negative experiences that it kind of sticks in our brain. Those negative feelings really stick in our brain where the positive feelings don't. So it's Velcro for the bad and Teflon for the good. And so we need to kind of balance this out within our society. So we still have those same brains, and yet we're in the 21st century. So the idea is to take in the good, which is essentially staying with the experiences when you have a positive experience as well. So the negativity biases means that our brains are always programmed towards those negative experiences. As we kind of open up, learn to take in the good, the positive experiences can stick faster. So the idea is to have a good experience, enrich it by staying with that feeling, absorb it, and you can actually even link it to a negative experience as well. So we're just going to finish off this session right now by taking you through that technique. And again, this is a very quick flash of it. But I want you to just bring to mind, in fact, you can bring yourself off the chair just for a second now, just bring your kind of meditation posture. In 4 slow breaths into the abdomen, and just feel what it's like to feel into your breathing. Now bring to mind the quality that you want to manifest in your life. So that could be confidence, it could be peace, could be whatever it is that you would like to aspire to have more of from a kind of mental state. Now remember when you were last in that state. What was the circumstance? What was happening? Where were you? Who was with you if there were people there? What was the environment? What did you see out there? What was the lighting? What was the sound around you? What were the feelings? How did your body feel? Now imagine that you're kind of generating that sense of peace and whatever quality within your brain right now, and it's actually getting absorbed into your brain, getting absorbed into your heart. It's sticking. Great, thank you. So you can bring your attention back out front. The takeaway point from this is when you're going through life and you have those positive states, actually stick with it. Because most of the time we just say, oh, I feel good right now, and then we're kind of on to the next thing. If you can do that for 15 or 20 seconds, whatever the state is, and say, oh, that's what it feels like to feel joy, or that is what it feels like to feel confident or grateful or whatever. If you can do that for 15 to 20 seconds minimum, 6 times a day, then you actually change your brain, and your brain will get better and better and better at that quality. And you'll change and grow as a person if you can do that. So I'm going to finish there. I think that's the end of the presentation. So thank you very much for all that. So.